I am with Meagan Brame. I'm so excited to be talking with you, Meagan. Thank you so much for taking the time to chat with me on what is a pretty crazy and stressful time for all of us right now, not just in childcare, but the world in general. So it's a big moment for us, hard, right?
It is, totally.
Yeah. So before we obviously we're here to talk about COVID-19 and childcare and all of that, but before we kind of dive into the details of that, let's just talk a little bit about you. So how long have you been working in the field of early childhood education?
I graduated in '88, and so about, what is that, 32 years now?
More than a few minutes.
And I have the gray hair to prove it.
Yeah, a little bit like me. I'm white now, so there you go. So there's some wisdom in this call between the two of us, I think. You know, we've been through a lot of moments in childcare here in British Columbia, but probably not quite like this one, right?
No, I've never would have ever pictured this unless I was watching Walking Dead. None of this, I would never have thought of this.
Yeah, it's a whole new world. So so you've been in the field quite a while now. You operate a childcare facility. Tell us a little bit about that and where you're located.
So I own and operate Saxe Point Day Care. It's in Esquimalt, BC, on the island. It itself has been in operation since 1971.
Wow.
I have been running it since 1990, but I've owned it since 94.
Okay.
So it started off, originally we had 4 toddlers and 16 3 to 5 year olds, but it was made kind of challenging with licensing. You know, the 4-year-olds or the 4 toddlers couldn't breathe or look at the 3 to 5s, and it just became a scheduling nightmare. So I dropped those probably 15 years ago or so. So now I just have 16 kids, 3 to 5.
Right, but really like a center with a long history now at this point in time. I mean, this program has been providing a valuable service in your community for a long time. Yeah,
49 years.
Yeah, my goodness, congratulations! Like that in itself is a monumental feat, right?
I often tell the Chamber of Commerce, I say, you're all about, oh, this business has been in the community. They often forget about childcare business and what they do for the economy.
Yeah.
When you're looking at an economic driver, and I'm like, I've been around, like this center's been around for 47 years. I've had it for a quarter of a century.
Yeah, absolutely. And I mean, we're going to dive into some details clearly about the impact of COVID-19 on childcare in BC, but you said something that I just want to pick up on, and that is childcare being an economic driver, right?
It is.
So from your perspective of having operated a childcare facility in your community, can you just talk a little bit about that, like the big picture of what you see in terms of supporting, children and families, and the importance of access to quality childcare, affordable, accessible childcare for children and families as part of driving a solid economy?
Well, it's both the economic and social economy as well. It's not just the monetary economy, but I mean, I have many parents who, they couldn't work if they didn't have affordable quality childcare. Their children, I get a lot of children that require extra support, and I always have. It seems to be a bit of my specialty. And because of that, the parents are getting good quality care. Their children are getting what they need developmentally, and I'm supporting the family that way so that they can actually go to work and feel like, okay, my child is getting what they need. I am able to be a productive member of society. And then we are also able to be a better family unit on the outside because of the fact that we are all getting our needs met. Exactly.
Like, and that's just, it's so essential, and it's so layered, right? There's so many parts to it, and all of it working together is really critical, right? Exactly. So outside of a moment like COVID-19, childcare, we know childcare is really essential. And so congratulations to you for playing such a valuable role in your community, right? Like, you know, you're moving into the point where generations of children are going through your care, right? And
Yeah.
I say that with respect and admiration for the contribution that you're making, right, and that your program has made. And so I feel I'm honored to have you here to talk about this, because I feel that you can, you know, bring a perspective that is very valuable, because you've been here and been operational for a good long time now, right?
Well, and one of the things, because I've been in for so long, I've seen a lot of changes.
Yes.
And it's interesting. One thing I'm hearing from people, there's so much angst and so much, nerves. And we've always had, like, if you've been in the field for any length of time, you've always had to deal with some changes.
That's right.
So I feel I'm a little bit more resilient, I think,
Yes.
because I've been around long enough to have gone through some of these weird and wonderful things. Not necessarily a pandemic, but a lot of other changes that have, freaked people out. I mean, so I've got some, deep breath.
You and me both, right? You and me
Yeah.
both. Like, and I think, probably what you're speaking, I won't put words in your mouth, but what I think that you're sort of alluding to is, before we got to the point of the pandemic, British Columbia was already going through massive changes to the childcare system with the current government's plan to implement universal childcare. And so we have gone through, is it fair to say it's been a pretty tricky and challenging time for the last 2.5 years now?
Yeah.
Stressful, right?
And it is, and it's been 2.5 years, but I even remember when I moved here from Ontario, because I moved here in basically December of '89 from Ontario, and Ontario was going through some changes when I left. And then I got here, and then BC adopted it, but then I knew that Ontario dropped it. So I've just been watching some of these things. So we've had little changes for the last 30 years.
Yes.
And now, then we had the big one 2.5 years ago, and now we've got the pandemic. We've definitely, it's kind of like the little, pre-shocks that you get in an earthquake. Now we're having the big one, and then it'll be the aftershocks, I'm sure, for a little while after.
Yeah, and I think that that's a very interesting context to kind of go into this discussion related to COVID-19, because there were already so many changes that were underway. And I think that, I mean, I'm interested in your perspective on sort of how people were feeling. Like, how would you say the sentiment was in the childcare sector before this crisis hit? Because I think that that's important to consider in relation to, we talk about resiliency, we talk about, weathering the storm, like all working together. But what's your perspective on that? How do you think it was?
There was definitely a couple different camps, I would say, beforehand. There was a lot of the, and I'm going to use my terminology versus the terminology that's out there, the private childcare. I refuse to call it profit, but the private childcare were really, it has just been building, and they're really feeling that they are being pushed out for nonprofit, because it started off everybody was going to get the money, and that was great, and then they've actually started wheeling it down, and there's more challenges for the private sector to be getting any of the.
When you say the money, you're referring to like various provincial funding that comes to childcare as a whole to support.
Exactly.
Right. Okay.
Yes. Sorry. Yes.
No, that's okay.
So that was, you were already feeling some, and so there was a lot of distrust for what was being trickled down, because, and I worked for the provincial government for a period of time. I was the ECE registrar for 18 months. And so I know they're usually thrown stuff and told to implement, and they have no time to implement. So I totally feel their pain. They're being told, do this. And then they do it, but they don't have a lot of time to fill in the gaps. And so then it gets more confusing and more convoluted. But that's the trust in the government right now is really low. They're afraid that if they do sign on to, say, this temporary emergency funding, that there's going to be a loophole in the bottom, in the fine print, that's going to come back and bite them. So some people are like, forget it, I'm just shutting my doors. I don't want their money. I'm going to charge the parents what I want to charge.
Right.
Because there's no sense of trust.
Yeah. So now we're really into the COVID-19 situation.
Yeah.
So where we are now in BC, unlike other provinces, elected not to close childcare facilities. Many other provinces did decide to close childcare facilities. So let's just talk a little bit about that for a second. When we were in the place where clearly this was going to be, you know, COVID-19 was definitely a thing, right? Yeah. A very serious public healthcare crisis. When we were in that place, how were you handling that as an operator? What were you sort of feeling? What were your concerns, I guess, before we knew how the government was going to respond?
Being a typical early childhood educator, I was concerned about my families that needed care. Because I do know that I have a few that, you know, I had a couple that really needed care. Then we had a bunch of people that were up in the air. And I also know that parents working from home with a preschooler are not as productive as if they were at daycare. I also worried about the kids and their skills, and, you know, what happens at home is not what happens at daycare. Absolutely. And that transition. And then I was worried about, okay, how am I going to pay my staff? I am lucky. I've been in business long enough that I have, you know, a reserve fund that can cover some of my bills, but I can't cover a lot of staff for very long. Right. So all of those things were running through my head, and I'm like, okay, well, I'll stay open as long as I can. I just may have to lay some people off, and you know, but I didn't even realize how much Dr. Henry was saying, you can work from home, stay at home, keep your kids at home. So now, in a way, I wonder, would it have been better to just shut us down? Because now right. I've got like 3.5 kids, right?
So I mean, Dr. Henry, they closed schools, but they did not close childcares. And the reasoning, as we understand it now, was to provide care for essential workers, frontline healthcare workers. But really, there was a period of time where we didn't really know what they were going to do, right? Like I feel as though there was about 10 days or something where the whole childcare sector was in limbo in BC. Yeah. And we were seeing more than anybody nobody was saying anything from government to us.
No, and I had parents emailing me every day. So what's going on? You know, they kept their child home. Do we come back? What's going on? What are we going to do? Are you charging us? That was the big one. Everybody was all about the dollar value. And I'm just like, I will tell you when I know. And I would just, every couple days I would send, this is what I know today.
Right. Very hard, like a very hard position to be in, right? For you as an operator and for families. And then like what we haven't talked about, I suppose, is even as all of this health information is coming out and what we know about social distancing and, you know, keeping safe, right? Keeping healthy, keeping staff healthy, children healthy. From your perspective, did you find that there was kind of conflicting information coming out, like, or did you feel that there was clear information coming out about the health side of things?
Very conflicting. I mean, at one point it was, if you have a cough, stay home 14 days. Now I keep hearing 10 days, and I don't know where I'm hearing that from, but I'm hearing it. And then I'm hearing kids can't give it to anybody, but then I thought I heard somebody say that some kids did have it. I'm hearing that, you know, stay home, you know. The other thing I get is they're sending things out so fully that we're not able to disseminate it before it goes to the parents. Because parents are like, oh, I don't have to pay for daycare. I'm just going to stay home. But I'm getting paid full time to be at home, but I'm not paying you to hold my spot. And yet now I'm getting parents who are like, okay, this working from home stuff with the preschooler isn't working. Am I classed as essential? I said, if I have room, we can work something out. But it's just so, this might work for another month of April, but if it goes into May, I can see a lot of parents going, I need my kid to go back to daycare. I am so not getting my work done. My child is we're starting to drive each other mentally insane. Right?
Yeah, and it's hard to know, because at the same time, there's also, that fear of community spread, right? And I have talked with some other operators who, honestly, they felt quite forced to stay open, because if they don't stay open, they won't be able to pay their bills, right? And lose their business.
Yep.
And some of them are immunocompromised or have health conditions. So it's a very strange place that we find ourselves in. Now, if someone was watching this, like, I'm sure we'll have lots of people from BC that will watch these conversations, right? Which is great.
Yeah.
But we may have people from other provinces that will watch, because they'll be interested to know what's happening in BC. So in your best possible version, how would you describe what the provincial government are currently offering for childcare at this point in time?
So in one hand, they're telling us to take as maximum number of children as we can for essential services, but to have social distancing, which I chuckle, because how much social distancing can you do with a 3-year-old who can't put on his own shoes or zip up his coat and always sneezes in your face as you're doing it? But for childcare, they're saying basically all of your parents, unless they're essential workers, don't have to pay. They're going to stay home with their kids. You take essential services. I don't know where they're coming from yet, because I haven't had any calls yet, except for a teacher from another local school.
Okay.
Then but we still have to meet our ratios. We still have to clean. We still have to do and we'll get 7 times, if I stay open, I'll get 7 times my base funding of childcare operating funding. Now 7 times, and they said your average over the last 6 months. So the average over the last 6 months, I looked at it and I think I worked it out too. Hang on, I actually wrote it down.
Okay.
It looks like I averaged it out to be about $16.85 a month was my average.
Okay.
Times that by 7, that's $11,799.
So you have to, for that amount of money, stay open and operate your facility.
Yes.
Now, in your case, I mean, it's interesting for me hearing this, and thank you for sharing what the number is. I guess it really depends. Some facilities are, depending on the market or the location that they're in, their lease costs are
could be that
or more. I've heard even more, right? Depending on the size of the facility. So for you, are you in a position that is that amount of money covering your basic amount to operate, or are you looking to find funds from elsewhere to
and then you also get your fee incentive on top of that. So if you have 3 kids,
okay,
say, there's $300. And then if I have 3 kids and their full fees, if they were 3 full-time kids, right. So I was getting my full fee, which is $875 after the fee reduction, right?
Yes.
That's $14,000 a month, which would cover 2 staff and my bills, barely. Okay. I'm still it just on the line, and I cut out all field trips. I cut out some of those extras, but you look at your bookkeeping costs, your hydro, internet, phone, all that. So I need 3 kids to kind of break even. Right. No kids and having my door open.
So
and that's keeping 2 staff, because you can't work by yourself all the time.
Of course not, right?
That's keeping 2 staff full time.
Right.
I need at minimum 3 full-time kids to at least break even.
So now in deciding to do this, I mean, clearly you're deciding to do this and offering this service for frontline healthcare workers, which obviously is critically important, and I have huge admiration, for you to do that, because obviously there are risks associated with doing that. But we want to support those frontline healthcare workers. I don't think there's any question of that in the childcare sector at all. I think the greater challenge has been the approach that has been taken in getting us to this place of of having centers offer this care, right? It could have been, it could have gone a little bit easier in getting us there. But having said that, then you're choosing to stay open, but there is some funding that is offered if you felt that the risk was too great and you wanted to close. But would that level of funding have covered you in terms of your?
Good golly, no. That, let me see here. We'll just take my base funding that I just told you, which was $1,685, times that by 2. That's $3,300 a month.
Okay, so at that point, would you have even been able to, like
No.
So I mean, I guess what I'm ultimately asking is the package that has been put forward, this funding that has been put forward by the provincial government, are you more or less pushed into a place that you have to stay open in order to have a childcare to go back to? Is that the place?
Yes.
That you're in?
Yes.
And how do you feel about that?
I personally don't mind working.
Okay.
But I'm a little worried about what they're going to throw at me, because I was reading the guidelines for the temporary emergency funding. That's 7 times my base funding. And there's some pretty firm terminology in there that I must do this, I must take these people, I must do this. First of all, I've had it out on, I've sent it out to my local township for township staff. I've put it out to the military, because I'm a military community. I've put it out to the Military Family Resource Center that I'm taking emergency or essential personnel.
Right.
I've even put it out on the Facebook world of this is what I'm doing. All I'm getting is teachers, and none of them wanting full-time. And
teachers, there's in the essential services, there's tiers, right? So teachers are not tier 1.
No, they're, I think, what, tier 2?
4, or I think farther down even.
Are they?
I could be wrong, but they're definitely not tier 1. Tier 1 frontline healthcare workers.
Yet I have 2 public health nurse parents, and they're choosing to keep their child home.
Interesting. Yeah.
So I'm like, okay. So, and they said that, I mean, I don't normally take nurses because well, actually that's not true. In the past, I've had parents that were nurses, but they had backup parents, picking up and stuff to keep the hours. But they're now telling me I could be forced to open up a 12-hour daycare. I could have night shift.
That's in the contract.
Oh, it's in the guidelines. It says that if the community requires different hours, that I will do that.
So now this is interesting to me, because they had these sort of calls where you could call into the government and ask questions, right? And I don't know if I called in for 2 of those just to hear the questions of operators. Or did you? I was in
the first one, and I asked a question about the fee reduction and how that was going to work, and I'm not really sure I got a fully clear answer, but yeah.
Right. So what's interesting is that some of what I've been hearing as I've been interviewing and talking with people, and in fact I spoke with someone this morning who mentioned to me that the information that they were provided on the call about when children would be referred to their facility was that it was still very much the operator's choice whether or not they could support the needs of that child and that family. And then of course, when they received the contract, that it was quite different.
Yes.
So there's a tremendous amount of conflicting information that is happening, isn't there?
Yes, I guess the wording they use is making every responsible effort as able and as needed to provide care in response to community need. This may include adjusting days or hours of operations, providing care during non-standard hours to accommodate shift workers. So it's very vague. Mm-hmm. Mm-hmm. In one aspect, they could come back and say, well, we said you have to make every reasonable effort. Why didn't you do that? One of your employees lives upstairs. They could offer 12-hour care. Well, but that's not what they want. It's not what they signed up for.
Right. Exactly. Exactly.
So it is,
So I guess it will be a question of what is reasonable effort.
yeah.
And it's complex. There's no question about it. It's complex, isn't it?
Yeah. And see, for me, I don't normally take children part-time. It's
Okay.
full-time. You pay full-time or not at all. So for me, I'm making an effort to accommodate these people that only need 3 days a week.
Mm-hmm. Mm-hmm.
So I'm trying, but I'm not going to stay open till 6 o'clock at night
Right.
and then still have to clean, because I have other families that have to start at 7 and I can't afford too many staff because they're not all paying me full fees.
Right.
I mean,
Now, you've mentioned cleaning. This has been an issue that I've heard. How are you doing with access to cleaning supplies and ability to sanitize, like bleach and things like that? Where are you at?
well, I'm using a product called Saval, which has the number and everything,
Mm-hmm.
which I've always used. So I had a full jug, and just when I opened that jug, I called Acme to say, send me 2 more bottles. That was 2 weeks ago, and I still don't have it. So I've got a bottle. I'd rather not go back to bleach, because bleach is not good, especially because this is a respiratory thing. You
Yes.
don't want to damage it even more. But I just constantly walk around with a bottle of Saval and water, and every time, somebody washes their hands at the sink, spray, wash, we've only got 2 kids, so it's not too hard, but you played with these toys, they go up on the shelf, we'll wash them later. If they're not washable, we have to write it down. This is the date we use them. We can't play with them for at least 72 hours. It gets, there's a list of toys, and I have really dry hands.
Yeah, I understand. It's the way of the world right now, right?
Well, and I've closed the daycare at 4:30. Normally I would be open till 5:30, but I've said, no, I would like to close. Everybody needs to be picked up at 4:30, 4:35, because that gives us, the last 2 people. Right now, that's how I've got the shifts worked, is the 2 people in the morning, 2 people in the afternoon, even though we really only need 1, but that way you've got 1 that can go around and clean up after us.
Mm-hmm.
And the last 2 people at the end of the day can do the really good blitz clean, so that
Right.
the morning it's open the doors and we're good to go.
Yeah. So it's a lot. I mean, it's a lot of reconfiguring and a lot of working in these new unknown circumstances. It's hard and it's scary.
Yeah.
But you're doing the best that you can to weather this storm, I guess, like all of us, really. And I mean, childcare is not the only sector that is facing challenges. I mean, we fully recognize that, right? But the challenges that we are facing in childcare are quite unique, right? Because bottom line is we need childcare available for people to be able to go back to. So,
well, and I'm already hearing from parents, they're like, I don't know what to do with my child anymore. Like, we can't go anywhere, we can't do this. So, I sent a few activity ideas. I just went around to all the families that we could walk to, because when you only have 2 kids and they don't really want them playing on playgrounds, we go for a lot of walks.
right.
So just to get out and get the fresh air. So my staff and I, we made up these little bags there's some art activities in them, parents, and even a recipe for homemade glue if you don't have any glue at home. And we're dropping them off in Ziploc bags. They've been set aside for 72 hours, so that any germs might be on them. We drop them off at the doors today, and then they just have to drop the bags off, because most of our families are neighborhood. So they'll just drop the bag off in our mailbox when they're done, so that next week we can
that's incredible. That's wonderful that you're doing that.
Well, and it's to keep the connection. It's to give the parents at least some ideas. They can move on from there. Mm-hmm. I even found how to make homemade paint recipe. But it's trying to keep that connection with them.
Yes.
And try to be supportive. Sometimes I don't feel that the parents are all that supportive back, because,
Well, do you think though that some of that has to do with the approach that was taken and the way communication has been handled, caused confusion for families and for childcare providers? And because childcare didn't really know what was going to happen, in a sense, it put us into a challenging place too, right?
It did, and I just don't. You know, I just worry. I want people to realize that we are caregivers. This is our income. If
Yes.
we don't have children, we cannot run. And
Right.
that is, I don't think there's enough people outside our sector that really truly understands the devastation that could possibly occur if this lasts longer than May.
I agree. Yeah. Yeah. I understand.
Not everybody's been in business as long as I have and have that backup of cash in the bank that I've meticulously saved for a rainy day fund.
Right.
A lot of, childcare providers, they're trying to keep their, we've been told, no, you can't raise your fees. So people have lower fees, but now they're going to have no income or very little income. So,
right. So some of the requirements with the change to the universal system and moving towards new rules and guidelines and things have limited facilities to be able to do certain things, right? And one of the things that I've definitely heard about is that the ability to kind of have a contingency fund and build that up over time has been really diminished.
Yes.
So it's hard, and really in any, personally and in a business, it's just good practice to be able to, have that rainy day fund for an emergency, right?
Yeah.
So if these sort of guidelines and things that have been put in place by the government prior to COVID-19 impacted further childcare's ability to be resilient in a time like this, it sort of painted us into a corner. Like, what can you say about that, right? And then
they also say in here that if you actually make a little bit of money, like there was supposed to be, and your incentive for staying open is this. They said
right.
those words. They said
they did say incentive.
If you make money, you have to give it back.
So, and how do you clarify what that is? Because I haven't really heard from anybody that's making money so far. I've heard from people who are just hanging on, literally hanging on. They're deferring things. They're all of that. So it's fascinating to me. There's a disconnect.
Yeah, there was supposed to be an incentive for doing this, and there's no longer an incentive. It's becoming tooth and nail. Now they're saying, if we see at the end of the year that when we look at this, if you've made too much money, we're going to, ask for this back. And even actually the federal government just did that today with the wage subsidy. So that got changed quite sharply from the brief reading I read today. So it's to the point where, why am I staying open? Would it be better just to lay off all my staff and I use the savings to pay my wage? Because self-employed, you got to watch the loopholes and the fine print in there as well with the stuff that they put out. Do I just do it that way? I'm trying for my families though to keep open for those that need it, and that's ultimately what I've always done. Why do I not charge more? Why am I open 51 weeks a year versus many centers that close down like 3 or 4 weeks a year? It's because I know the families need care.
Right. So you're committed to providing a program that meets the needs of your community. Yet it's bottom line is it sounds like all of this, before, during, and probably after COVID seems like it's making it harder and harder to be able to do that.
It is.
Isn't that funny? Not funny, but
even just all the requirements that they want us to do. Like, I basically have to have 2 staff so that I can make sure that I'm filling out all the paperwork, and I have no idea when I'll even get paid. Right?
So you've not had any certainty provided around that.
Today we got the email with the link, and I had to work this morning, so I haven't been able to actually sign up.
Right.
I don't know when the money's going to come in. But then they said, but we paid you last month. We paid you half of it already because, we all filed in March 15th for April. But then they're going to shave some stuff off here. And What about the affordable childcare benefit? Because we all applied for that on the 15th, like we were supposed to for next month, but now those kids aren't coming. Are we going to have to pay that $1,000 back?
So, I mean, you're describing to me that, what is nothing less than, it sounds like a bureaucratic nightmare, right?
Yeah.
Like, really. So how reasonable in your, thinking back over the years of all the different times that you've, gone through various government programs and stuff, am I right in saying that it seems like there is a lot more administrative work with every approach that's taken right now? Like, it's very
Huge.
heavy administratively.
Huge. And I remember, when before all the government subsidies, when it was just literally a parent applied for a subsidy, I was opening up another center in Sault, and they were like, well, no, I want you to have a separate manager, a manager that doesn't work on the floor. And I said, well, where would you want me to get the funds for that? I said, I can't have an extra staff like that. And in hindsight, now that's what my role is. I work on the floor more to cover for vacation and sick and to help with some transitions on field trip days and things like that. But because I spend so much time doing bloomin' paperwork.
Right. So really, does that take away from some of the joy of being in the field?
Yes, I actually really do miss being on the floor more. And I also, it's harder for me to mentor the young staff.
Yeah,
they don't know the nuances. They don't know. Yeah.
Mm-hmm.
How do you actually talk to a parent about fees or do that? Like, they learn a lot by watching how I interact with the parents, how when a parent comes with a concern, how I have the discussion with them, how I deal with challenging behaviors in children. Because I mean, some staff these days are very, very green. Like, there's not a lot of you and I left out in the field.
Right, absolutely. We have definite challenges with finding, qualified staff, and then, staff that are, unfortunately, sometimes we have textbook smart early childhood educators, but they are not practical smart, right? And practical smart comes from experience, and it comes from, being guided and mentored over time, right, by more seasoned and knowledgeable early childhood educators, right? Like, it really, the work we do is an art and a craft, right? It really is.
Yeah, there's what you learn in the textbook, and then there's some reality that happens in there that is different, and you don't know it until, like, I get students from local colleges, and they're like, wow, we didn't learn about that in the text at school. Yeah, and you won't until you're faced, because the textbook can't cover every single personality type that we get.
No, it totally can't. So again, in this time now when we have a shortage of qualified staff, we know that we need staff to be really mentored, younger, more junior staff. And where are you but in your office doing paperwork? Concerning, right? It is concerning. Yeah. And then my concern is, like, I don't want to say it's a luxury, because it's not, but you're in a position where you can, to a degree, step away and do that. But if I'm operating an in-home multi-age,
not a hope.
When am I doing that, right? And I see this when I talk with childcare providers of all different types. There are some very, very stressed early childhood educators that are just trying to do the best they can with their programs, and the funding discrepancies. And I fear, and I don't know how you feel, but I fear that childcare in BC will
implode.
I'm worried about that. I really am. I'm worried that we're going to lose, because of COVID-19 is going to be like that tipping point. We were already very, very vulnerable, and the changes that were being made, change is hard. There's no question about it, but it put us into a place of vulnerability that I don't think we've been in before, even though we've had more difficult times for sure, and come through difficulties, but I don't know.
And
Are you worried about that?
well, one thing that worries me is burnout. And the one thing that kills me is they keep saying quality, quality, quality. If you have stressed out staff, it's hard to give quality when you can't even, when you're struggling to take care of yourself at a certain point in time because you've got so much to do. It's hard to take care of somebody else, or you're giving it to everybody else and you're not taking it for yourself, and then you burn out, you get sick. I mean, I know 2 educators who have had heart attacks in their early 40s.
Actually, I'm aware of that too, right?
And that is so troubling to me.
I agree. It's very troubling.
I mean, we don't treat teachers this way. Elementary, middle school teachers, high school teachers this way, but it seems to be okay to pile this all onto childcare providers, nonprofit, private, whichever. But you're right. I actually am concerned. You know, all these spaces that were created. I think we're going to be in the minuses of those spaces when we are done this. If it lasts longer than May, for sure, there's going to be a problem.
Yeah, I mean, I think it's a problem that is not just with programs, but also with educators, right? Because I'm definitely hearing of educators who are saying, I'm out. I am when this is done, I'm not coming back, right? I'm done. I'm just done. And then I'm hearing from childcare programs who, if it goes on, they won't be able to weather the storm unless there's much more significant funding. There's just no way they won't. Yeah. And so programs, they'll go bankrupt or they'll be lost. They won't be able to get through this. And
they won't be able to pay their rent.
Not the only one. I mean, everybody's facing this challenge. Yeah. But the thing is, we need childcare to be there so that people can go back to work when we try to revive the economy after this. Yeah. So it's incumbent upon us collectively and the government and their leadership to ensure that we are. And it's questionable whether or not that's happening at this point, you know? Yeah. So
and there's still a big, about a week ago, I think I'm going to take this as valid. Somebody had posted that they were getting phone calls from people going, why are you open? You shouldn't be open, and harassing them.
Yes.
Which isn't fair either. It's like, you're darned if you do, and you're darned if you don't.
And there's been even before when it was okay to go for a walk, right? And there's varying opinions, you know, on whether or not it's okay to go for a walk, but childcare providers who have been harassed while taking groups of children out for walks. Like there's a lot of, you know, the public is watching, they're watching for groups. Like, this is a tough time to keep on doing what it is that we do best.
Well, and to go back to your conflicting information, you know, Dr. Henry said close playgrounds. We all got a note from our public health, from VHA, saying it's okay to play on the playground.
Yes. So VHA is, just for anybody that doesn't know, that's your...
Yes, that's Vancouver Island, Vancouver Health Authority.
Right. Okay. So your health region. Yeah.
Yeah. So it's like, wow, is Dr. Henry not their boss?
Right. So a lot, gosh, wow. I don't know. I don't feel that there's any, like, you know, good note that we can end this conversation on, other than to acknowledge it's a tough time. Right.
And it's ongoing, ever changing. We just have to take a big deep breath and go forward as best we can, whatever fits for the provider.
Absolutely.
Some will be just like, I can't do this. And you know what? There is no problem with that. And some will like, I'm going to chug on, and that's okay too. Ultimately, people have to do what's right for them, even more so than the families they care for. I think fundamentally we need to start looking at ourselves and what we can handle.
And I think I was just going to say, ask you, like, as a final question, like, from all of your years of practice and work, you know, what's the wisdom that you could close out on? And I mean, I think it sounds like that's it. To listen
Yeah,
to yourself, right? Do it.
exactly. Listen to yourself. Ultimately, it is your job, your business, whichever it is. You do what you need to do to keep you healthy and safe.
Good words of wisdom. Thank you so much. Thank you so much for talking with me and, you know, sharing your story. And I wish you all the best moving forward. You know, maybe we can have a post COVID-19 conversation and kind of catch up, right? So
That
but
would be great.
thank you so much, Meagan.
All right, take care.
Take care. Okay. Bye-bye.